The newest book from Deep Knowledge Group general partner Dmitry Kaminsky presents a proposed solution to one of the longevity industry's biggest and most fundamental disproportions and sources of risk, illustrating how a specific set of market-ready tools and technologies can very quickly accelerate longevity industry growth, optimize R&D, pave the way to unlocking and unleashing untouched trillions in new investment capital, de-risk and modernize longevity investing, and immediately translate longevity science and theory into real-world impacts on socially inclusive, practical, healthy human longevity. The book is a follow-up to Kaminsky's critically acclaimed first book, Longevity Industry 1.0, Defining the Biggest and Most Complex Industry in Human History, which distilled the complex assembly of deep market intelligence that Deep Knowledge Group and its longevity-focused subsidiaries, including Longevity Capital and Aging Analytics Agency, have developed over the past 7 years into a full-scope understanding of the global longevity industry. It represents the newest entry in a sequence of longevity-themed books being released over the course of the coming year, focusing on different specific domains, sectors, and driving forces behind the global megatrend of longevity industrialization. In his newest book, Kaminsky unveils how biomarkers of human longevity will come to serve as a major catalyst and accelerator of short-term practical applications, the translation of theory into practice, and industry de-risking, stabilization, and sustainable growth across every major aspect, domain, and driving force of the global longevity megatrend. The book begins by discussing the unmet need for a true industry consensus framework of biomarkers of human longevity, what they are, how they should be used and applied within the industry, and how this issue intersects with a major existing disproportion and fundamental risk at the longevity industry's core, namely over-reliance on positive results in animal models rather than humans. By investigating the current state of longevity clinical trials, Kaminsky showcases many of the real-world consequences of the industry's lack of a more human-centric approach to therapeutic validation, and how this has led to a very few indisputably safe and validated longevity therapies and technologies coming to market. The book then analyzes how these disproportions play out in public markets, showcasing several notable cases of publicly traded longevity companies experiencing changes in their market capitalization and stock price dynamics following the release of clinical trial results. Against this backdrop, the book then casts its eye towards the longevity financial industry, detailing the ways that biomarkers of human longevity are quite simply the only available tool for de-risking investments in an easy, effective, and market-ready way. This de-risking is necessary to allow conservative institutional investors, UHNWIs, and large financial corporations to begin actively fueling further industry growth at the exact moment when their active involvement is needed to maintain the global longevity industry's upward trajectory of development. However, Kaminsky argues that more needs to be done and that smart longevity investors need to begin onboarding and utilizing biomarkers of human longevity for investment target identification, company valuation, and due diligence processes to make strategic decision-making more modern, relevant, and reliable, and to de-risk the translational gap from model organisms to humans. Such frameworks need to become industry standard tools in order to provide the levels of stability and predictive reliability expected of large conservative investors and financial institutions. This will unleash a near unlimited source of investment capital capable of bridging the big longevity liquidity gap and enable the establishment of the kinds of financial entities, markets, and systems required to drive the evolution from longevity industry 1.0 to 2.0, including longevity investment banks, stock exchanges, ETFs, and index funds and novel financial instruments, which will need high degrees of industry stability and reliable predictive forecasting to operate in a relevant way. Finally, the book closes by charting the future of human biomarkers of longevity from now, 2021, to 2030, outlining the ways that longevity biomarkers will be essential to achieving real-world results in practical human longevity, and how the increasing capacity for inexpensive consumer-grade devices to be used as tools for the aggregation, storage, and analysis of high volumes of individual biological and non-biological data is naturally leading towards the creation and adoption increasingly effective, efficient, and sophisticated virtual models of individual humans. These models can be considered as digital human avatars. The numerous developments occurring in the biomarkers research sphere are quickly converging to enable personalized predictive models of individual humans. Digital human avatars will eventually develop to encompass the full scope of multi-dimensional markers, biological, technological, financial, environmental, infrastructural, regional, and even political, that have an impact on health, wealth, performance, and longevity. Ultimately, the book argues that biomarkers of human longevity will prove to be the critical catalyst not only for maintaining the global longevity industry's continued positive development and growth, but for accelerating it, for neutralizing existing risks and disproportions, and for translating the potentials of existing theoretical R&D into real-world, tangible impact on healthy human longevity.